Have you had a tough time finding a new doctor? A new study out of Long Island reveals there really is a doctor shortage. CBS News' John Diaz explains why and what you as a patient can do to prepare.
It takes at least 3 months to get an appointment.
Like so many across Long Island, Christine Faraday has been struggling to find doctor's appointments in a timely fashion.
Whoever gives me the quickest appointment is what I take.
A new Northwell Health research suggests it could get worse, claiming the United States and Long Island are both facing a primary care doctor shortage, which by 2034 could leave America with a deficiency of around 48,000 doctors.
That's 72 million people in the U.S. that are going to be out a doctor.
Dr. Lauren Block is the senior author of the findings, which stem from the Feinstein Institutes for Medical Research.
Locally, what we've been noting is we're having trouble finding general internists to replace our doctors who are retiring.
Her research shows the number of residents choosing general internal medicine paths, also known as primary care, has halved in the last 10 years.
More and more people are going to work in hospital medicine and other careers that pay more.
And other medical experts say that's where people may end up too if primary care does start to fade away. They will have limited options.
It makes access to healthcare much more difficult, and patients end up typically going to the emergency room. They just don't have that relationship, that continuity that they would have with a primary care provider.
Doctors say the elderly are most at risk. Census data from 2020 shows Long Island's overall median age rose 2 years higher than it was a decade ago, surpassing the state and national median age. So with the island's population aging rapidly, economists fear demand for doctors will outgrow supply.
We need to focus on how can we prepare a workforce, particularly on the medical side, to meet the aging population group.
And experts say if you want to get ahead of this, you should start to get to know a couple of different doctors within your area or different doctors within one practice, just in case one is booked up. John Diaz, CBS 2 News.
Doctors say the elderly are most at risk, and when it comes to Long Island, census data shows the elderly population there is higher than the state and the national average.